Hi one and all, this is Dr. Vasavi working as a consultant periodontist in KIMS Dental Kondapur branch. Today the topic of discussion is laser disinfection. Laser disinfection. Laser disinfection is the treatment line for the gum diseases or periodontal diseases. So that will disinfect the gum areas to decrease the level of the microbial count at the gum level, which in turn results in the healthy gums. What is laser? Laser amplification by stimulated emission of radiation. There are different variations in the laser applications. First thing, laser is available in two forms. One is the hard tissue laser and the soft tissue laser. Hard tissue laser, the approaches are different. Today we will be discussing the soft tissue laser, mainly the diode lasers, which are useful in the gum therapy. Namely, we use diode lasers mainly for the laser disinfection or the LENAP, laser assisted new attachment procedures, or open flap debridement with laser disinfection. These are the different approaches of laser in the gum treatment. Coming to laser disinfection, in this laser disinfection, first we'll cleanly or thoroughly clean the tooth surfaces, followed by the application of the laser in the pocket areas, which will remove the unhealthy epithelial attachment or decrease the microbial count, in turn results in the formation of a healthy junction epithelium. This is the laser protocol, disinfection protocol which will follow gum treatments or in gingivitis or periodontitis patients. Coming to the other application of laser in gum treatment, that is LENAP, laser assisted new attachment procedure. In this also, in the first phase therapy, will clean or thoroughly debride the tooth surfaces and will recall the patient after 2 or 3 weeks and will apply the laser into the pockets which are greater than 5 mm and will thoroughly remove the unhealthy epithelium and induce a fresh bleeding site by using the periosteal elevator and close the area. And this induced bleeding which is done after the removal of the unhealthy epithelium results in the reattachment procedures. These are helpful in preventing the tooth for the further bone loss. So this is also one of the renewed therapy in the laser treatments in the gum therapies. And the third one is in open flap debridement. In this, nothing but the complete flap surgery is also. After opening the flap, we will clean and also will pass the lasers in conjunction with the open flap debridement, also results in the improved outputs. These are the different applications of laser in gum treatments, and these are also helpful. The lasers are also helpful in frenectomy procedures or vestibuloplasty procedures or in the depigmentation procedures. These are the various applications of laser in the oral cavity.